Brr. Is it cold in here?
No, Taylor, that's just frozen shoulder. Hey guys, so today we're going to talk about frozen shoulder, also known as adhesive capsulitis. My name is Mark. I'm one of the therapists here at John Getz Physical Therapy, and this.
I'm Taylor Mikesell. I'm also a physical therapist here at John Getz Physical Therapy.
All right, and in this video we're going to talk about a little bit of frozen shoulder and a couple of things that you need to know. Tell us a little bit about frozen shoulder, Taylor.
So, frozen shoulder is also known as adhesive capsulitis. And basically what that means is, if we think of our shoulder, it's basically a golf ball sitting on a golf tee. And then you have a capsule that sits around it, basically helps keep it from flying off the golf tee. So it keeps from dislocating, subluxing, and creates stability in the shoulder. In frozen shoulder, the capsule tightens through a bunch of adhesions, and it gives patients a lot of pain, a lot of loss of mobility of their shoulder. They have problems, lifting their arm up, lifting their arm out to the side, reaching behind their back to get dressed or whatever. There's 4 stages of it.
That's right.
Mark, tell us about them.
So Taylor's right. There are 4 stages to frozen shoulder. The first one is what we call more of a pre-freezing stage. Usually lasts somewhere between 1 to 3 months. And then usually there's an onset of some aching and pain just with motion. And then the next stage is your freezing phase. It lasts about 3 to 9 months. And then your frozen stage, where you have no motion, your pain's slowly starting to go away, but you really can't move the arm around very much, and that's about 9 to 14 months. And then your last phase is the thawing phase, where the pain is starting to go away. You're starting to get that motion back, and that usually what did you say? That 14 months to 20. What's
It's
that?
usually 18 to 20, somewhere in there.
Something like that. And one extra thing to know about these with frozen shoulder, it's more common in women than it is in men. Also, if you're diabetic, you're prone to have frozen shoulder, or if you've ever had any trauma or rotator cuff repair, you're more likely to have it, or if you've had frozen shoulder before, you're more likely to have it again.
And is it our dominant arm or our non-dominant arm?
Good point. It's more of our non-dominant arm that will have it. Good, I'm glad you said that.
But it doesn't mean that that's the only arm it can affect. It's just more common in the opposite shoulder.
Right.
So Mark, tell me, what do we do here that helps people get better from frozen shoulders?
So with frozen shoulder, it's usually the capsule that we have to get loosened up the most. But before we get to the capsule, we try and loosen up the soft tissue around the shoulder to loosen up that any adhesions that might restrict some motion that you might have. So we work a little bit of the muscles or on the front of the shoulder or in the back of the shoulder. One of the things that is really common, we got to work on this posterior glide, trying to get that moving this way. How's that feel? Right there, or we also got to work the capsule, stretch it this way as well. That's the main thing with frozen shoulder. We gotta get this moving. The one thing I will say though, depending on what stage you're in with frozen shoulder, that will change how your therapist will approach how much pressure and how much they do with your shoulder, because some stages are more painful than others, and that's why there's a good communication between the patient and the therapist to letting us know what they can tolerate. Anything you want to add to that? No. So a couple things that we do. I like to stretch out the posterior capsule of the shoulder. Put my hand underneath their shoulder to help stabilize their scapula. My hand's on their elbow, and I just add a little bit of pressure down. How does that feel, Taylor? Feel good?
It's like stretching.
Yeah. And just feel a little stretch in the back of the shoulder. Okay. That's just something we'll work on. Stretch it out. We can add some motion into it. Go push up into me, and then relax. Do it again. And relax. And that's more of what we do. We try to get a little bit more function out of it with the patient.
When you stretch it posteriorly, what does it help me do? Does that tell me to lift my arm up?
So good point. So when I work on trying to get this back and down, this posterior glide helps with more of an internal rotation. So for you ladies trying to get into your bra, or just late guys, or in general, anybody trying to tuck your shirt, that's one thing we do with that. For elevation, when we go up, we work on just bringing the capsule down in more of an inferior glide from this way, and then Taylor, I'm going to pull your elbow down to your side, and then relax it. And that's one functional way we can do it, or relax it there, or if depending on what stage they're in, we can just do some oscillations and working into it, just to get you used to our touch and get that shoulder moving better. Yeah.
Okay. So, if anyone's told you that you've had frozen shoulder, or you're having problems with reaching your arm forward, out to the side, behind your back, if it's keeping you from doing anything that you want to do,
Right.
maybe play tennis or whatever that may be, this workshop is for you guys. Mark, tell them how to sign up.
All right, so if you have any of these symptoms, or if you've been told, like Taylor said, if you have frozen shoulder, all you have to do is give us a call at 904-280-2001 to sign up for our live workshop that we will have here November 18th. It's at 6:30. Or if you would like, you can also go online to manualpt.com and sign up for our workshop there as well. What else? About it.
I think that's it.
Guys, thank you guys for watching, and hopefully we'll get a chance to get our hands on you and thaw you out.
Let's thaw those shoulders out. We look forward to hearing from you. Thanks, guys.
Bye.